Hi, I'm John Martin, Prevention and Education Programs Manager at Southwest Center for HIV-AIDS. Southwest Center for HIV-AIDS was formed originally under the name Body Positive in 1988. They were one of the first organizations to address HIV in Phoenix, and they began offering the services that they seemed to find that most people needed. Alternative therapies to help them deal with the devastating effects of the disease itself, and then early research into treatments for HIV. At the time, there was really nothing available. Over the years, our services have evolved as better medications have come out and as the needs of people living with HIV have changed. There are currently 34 medications to treat HIV on the market. 32 of those medications came through our clinical trials program. We were one of the sites that conducted trials on those. So the work that we have done, despite being a small agency, has really had a worldwide impact. In Arizona, currently there are close to 15,000 people diagnosed with HIV. And it's estimated that there are nearly 17,000 people that have HIV, meaning that about 2,000 people out there do not know they are living with the disease and therefore could unintentionally be spreading that. So one of the things that we really stress in our agency is HIV testing. We have a very large and very successful HIV testing program, tests about 2,100 people a year, and we find about 3 to 4% of those people come back with positive test results. The Southwest Center's services are rather unique in that we offer a combination of prevention and education programs, health and wellness services, and clinical trials research. Those are services that are offered by separate agencies, and we combine them under one roof. These days, HIV is not the death sentence that it once was. Back in the 80s and early 90s, when a person got an HIV diagnosis, they were going to die from AIDS-related causes within a relatively short period of time. So a lot of the awareness about HIV, a lot of the push to prevent and cure HIV has really fallen away. People today aren't aware of the need to protect themselves like they were perhaps back in the 80s and early 90s. Living with HIV it's not as simple a chronic condition as something like diabetes. A lot of the health struggles that people face now are due to accelerated aging and dealing with the sort of very toxic medications that they have to take. So while HIV is somewhat manageable, I want to stress that it's somewhat manageable. It is not over by any means. And so we really need to stress that people still need to become educated about HIV, and then those living with it still have plenty of struggles in order to stay healthy and live a long, productive life. But we need your help. Changes in federal and state funding have left many of our programs struggling for survival. We need to reach more people that are at risk and help those that are living with HIV live long and healthy lives. Together, we can make this happen.